Sure.
Namaste Pitya, myself JVN Dr. Suman Shekhawat, Department of Kaya Chikitsa, Faculty of Ayurvedic Sciences, JAYOTI Vidyapeeth Women's University, Jaipur. Today we will be discussing about typhoid. First of all, we will be discussing about the introduction of typhoid. Typhoid fever is a life-threatening illness caused by the bacterium Salmonella typhi. Salmonella typhi lives only in humans. Persons with typhoid fever carry the bacteria in their bloodstream and intestinal tract, transmitted through ingestion of food or drink that is contaminated by the feces or urine of infected people. If we are talking about the prevalence of the disease, first of all, we will be discussing about age. Typhoid fever may occur at any age, but it is considered to be a disease mainly of children and young adults. In endemic areas, the highest attack rate occurs in children aged 8 to 13 years. In a recent study from slums of Delhi, it was found that contrary to popular belief, the disease affects even children aged 1 to 5 years. Gender and races, Gender and race, typhoid fever cases are more commonly seen in male than in female. One of, on the contrary, female have a special predilection to become chronic carriers. Occupation, certain categories of person handling the infected material and live cultures of material and live cultures of Salmonella typhi are at increased risk of acquiring infections. Socio-economic factors. It is a disease of poverty as it is often associated with inadequate sanitation facilities and unsafe water supplies. Environmental factor. Though the cases are observed throughout of the year, the peak incidence of typhoid fever is reported during July to September. This period coincides with the rainy season and substantial increase in fly population. As you all know about this, social factors, pollution of drinking water supplies, open air defecation and urination, low standards of food, and personal hygiene and health ignorance. Nutritional status. Malnutrition may enhance the susceptibility to typhoid fever by altering the intestinal flora or other host defenses. If we are talking about the incubation period, usually 10 to 14 days, but it may be as short as 3 days or as long as 21 days, depending upon the dose of the inoculums. Reservoir of infection. Man is the only known reservoir of infection cases or carriers. Period of communicability. A case is infectious as long as the bacilli appear in stool or urine. If we are talking about the mode of transmission, then mode of transmission, the disease is transmitted by fecal-oral route or urine-oral routes, either directly through hands soiled with feces or urine of cases or carriers, or indirectly by ingestion of contaminated food, milk food, and through flies. Contaminated ice creams, and milk products are a rich source of infection. Carriers may be temporary or chronic. Temporary carriers are, if we are talking about convalescent or incubatory, carriers usually excrete bacilli up to 6 to 8 weeks. By the end of 1 year, 3 to 4% of cases continue to excrete typhoid bacilli. Persons who excrete the bacilli for more than a year after a clinical attack are called chronic carriers. If we are talking about the symptom of typhoid fever, then symptoms usually develop 1 to 3 weeks after exposure. It can be mild to severe. If we are talking about the symptoms of first week after infection, high fever 103 to 104 Fahrenheit, headache, constipation in adults, and diarrhea in children, rose colored spots on the chest, enlarged spleen and liver. Healthy carrier state may follow acute illness. Symptoms in second week: continuing high fever, either diarrhea that has the color and consistency of pea soup, or severe constipation, considerable weight loss, extremely distended abdomen. Symptoms in third week: become delirious, lie motionless and exhausted with your eyes half closed in what's known as the typhoid state. This is the typhoid state. Life-threatening complication after develop at this time. Fourth week, improvement may come slowly during the fourth week. Fever is likely to decrease gradually until your temperature returns to normal in other week to 10 days. Sign and symptom can return up to 2 weeks after fever has subsided. That why this is called recovery phase or improvement phase. Complication are the intestinal bleeding or perforation may develop in the third week of illness, sudden drop in blood pressure and shock, followed by the appearance of blood in stool, severe abdominal pain, nausea, vomiting, and bloodstream infection. These are the very important complications of typhoid fever. Just because these all are responsible for the medical emergency of the patient, sudden drop in blood pressure or shock, and blood in your stool, severe abdominal pain, just because of intestinal perforation. If we are talking about the diagnosis of the disease, typhoid should be considered in a patient with prolonged unexplained fever in endemic areas or in those with a history of recent travel to endemic areas. जो पेशेंट इस तरीके के हैं कि जिनको एंडेमिक एरियाज में ट्रैवलिंग की रीसेंट हिस्ट्री है, उनको रीसेंट हिस्ट्री है और अनएक्सप्लेन फीवर है, तो वहाँ पे हमें ज़रूर इसका डायग्नोसिस कराना चाहिए. अगर हम देखें प्रोलॉन्ग फीवर, रोज स्पॉट्स, रिलेटिव ब्रेडिकार्डिया, ल्यूकोपेनिया, डब्ल्यूबीसी काउंट का कम हो जाना, में typhoid strongly suggested. Vidal test measures titers of serum agglutinin against somatic O and flagellar H antigen. These are the antigens. Usually begins to appear during the second week. In the absence of recent immunization, a high titer of antibody to O antigen more than 1 ratio 640 is suggestive but not specific. Polymerase chain reaction PCR can be performed on mononuclear cells. The test is more sensitive than blood culture alone. 92% compared with 50 to 70%, but requires significant technical expertise. Blood culture are positive in 70 to 80% of cases during the first week. It is very, very important. Blood culture are positive in 70 to 80% of cases during the first week. Stool and urine culture are usually positive 45 to 75% during the second to third week. Bone marrow aspirate culture give the best confirmation 80 to 95%, and the tracing of carrier in cities by sewer swab technique. It is also very important that contamination अगर किसी पूरा एरिया में है तो वहाँ के लिए ये टेक्निक वेरी इम्पोर्टेंट, क्योंकि अगर कंटामिनेटेड सीवरेज वगैरह है और वहाँ का स्टूल अफेक्टेड है तो पूरे एरिया की जो कम्युनिटी है उसके अंदर इसके ट्रांसमिशन के और जो होता है ना उस एरिया के लोगों के पूरे एरिया के लोगों के अफेक्टेड होने के चांसेस बहुत ज्यादा रहते हैं, इसलिए वो भी जरूरी है। अगर हम यहाँ पे रैपिड टेस्ट फॉर डायग्नोसिस की बात करें तो किस तरह के टेस्ट जो हैं वो इसमें आते हैं, तो रैपिड टेस्ट की अगर हम बात करें तो टाइफी डॉट टेस्ट, टाइफी डॉट एम, टाइफी डॉट रैपिड, टाइफी डॉट टेस्ट दैट डिटेक्ट्स प्रेजेंस ऑफ IgM and IgM and IgG in 1 hour. Sensitivity more than 95% and specificity 75%. Sensitivity इसकी more than 95% है and specificity 75% है. Typhoid.M that detects IgM only, sensitivity 90% and specificity 93%. Typhoid.Rapid sensitivity 85% and specificity 99% is a rapid 15-minute immunochromatographic test to detect IgM. IgM dipstick test जैसे होमोसाइडल हो गया, रेप हो गया, डाउन डेथ हो गया. If we are talking about the management of typhoid, then it depends on general management and specific management. Specific management में जो है pharmacological management आता है कि किस तरह के medications patient को ऐसे condition में provide कराए जाते हैं, क्योंकि ये जो होता है ना लोग पुअर हाइजेनिक कंडीशंस की वजह से ज्यादा देखने को मिलता है। तो यहाँ पे अगर हम जनरल मैनेजमेंट की बात करें, सपोर्टिव केयर इंक्लूड्स यहाँ पे मेंटेनेंस ऑफ एडिक्वेट हाइड्रेशन एंड अप्रोप्रिएट न्यूट्रिशन इज वेरी इंपॉर्टेंट। इसके अलावा हमने देखा सिम्टम्स में कि प्रोलॉन्ग फीवर जो है वो यहाँ पे देखने को मिलता है। इनिशियली पेशेंट कैन टेक एंटीपायरेटिक। If you are talking about the specific management, then antimicrobial therapy is the mainstay treatment. Selection of antibiotics should be based on its efficacy, availability, and cost. If we are talking about that what kind of antibiotic we can give in this typhoid fever, then chloramphenicol, ampicillin, amoxicillin, trimethoprim, and sulfamethoxazole, fluoroquinolones. In case of phenol resistance, then azithromycin third generation cephalosporin, ceftriaxone. Control of typhoid fever, measures direct to reservoir, case detection and treatment, isolation, disinfection of stool and urine, detection and treatment of carriers, measures at route of transmission, water sanitation, food sanitation, excreta disposal, fry control, measures for susceptibles, immunoprophylaxis, and health education is also very important. First of all, health promotion. First of all, we should discussing about health promotion. Keep the premises and kitchen utensils clean. Dispose rubbish properly. Keep hand clean and fingernails trimmed. Wash hands properly with soap and water before eating and handling food and after toilet or changing diaper. Drinking water should be from the main and preferably boiled. Purchase fresh food from reliable source. Don't patronize illegal hawkers. Avoid high-risk food like shellfish, raw food, and semi-cooked food. Wear clean washable apron, caps during food preparation. Clean and wash food thoroughly. Scrub and rinse shellfish in clean water. Immerse them in clean water for some time to allow self-purification. Store perishable food in refrigerator, well-covered handle, and store raw and cooked food, especially seafood, separately. Upper compartment of the refrigerator for cooked food and lower compartment for raw food. To avoid cross-contamination, it is very important. Clean and defrost refrigerator regularly and keep the temperature at or below 4 degrees centigrade, 4 degrees Celsius. Cook food thoroughly. Don't handle cooked food with bare hands. Wear gloves if necessary. Consume food as soon as it is done. If necessary, refrigerator cooked leftover food and consume as soon as possible. Reheat thoroughly before consumption. Discard any added food items. Exclude typhoid carrier from handling food and from providing care to children. Indication for vaccination. Traveler going to endemic areas who will be staying for a prolonged period of time. Person with intimate exposure to a documented Salmonella typhi carrier. Microbiology laboratory technologists who work frequently with Salmonella typhi. Immigrants, military personnel, injectable typhoid. This single-dose injectable typhoid vaccine from the bacterial capsule of Salmonella typhi, strain of typhi 21A. This vaccine is recommended for use in children over 2 years of age. Subcutaneous or intramuscular injection can be given via these routes. Efficacy of this injection 64% to 74%. Side effect of injectable type 5. The most common adverse reaction are injection site pain, erythema, and induration, which almost always resolve within 48 hours of vaccination. Occasionally fever, flu-like episode, headache, tremors, abdominal pain, vomiting, diarrhea, cervical pain have been reported. This is all about, we have discussed about typhoid. We can take a quick recap. We have talked about the introduction of the disease. Causative factor is bacterium Salmonella typhi. This is the prevalence, age, gender, races. Most importantly, children aged 8 to 13 years. Children are mainly affected by the disease. Lower or poor socio-economic status. Incubation period 3 to 21 days, depending upon the dose of the inoculums. Reservoir. Man is the only known reservoir. Mode of transmission, fecal-oral route or urine-oral route. Contaminated water, milk, food through flies. Carrier may be temporary and may be chronic. If excreta the bacilli for more than a year after a clinical attack are called chronic carrier. We have discussed about the symptoms according to the weeks. First week, second week, third week. Third week is life-threatening complication. We have seen life-threatening complication complication often develop at this time. Complications, intestinal perforation, and it can be life-threatening also. If we are talking about the diagnosis, then we can see we have seen Vidal test, PCR, blood culture, stool and urine culture, bone marrow aspiration, typhoid test, typhoid M and typhoid rapid, IgM, dipstick test, management according to the we have discussed measure directed to reservoir, measures at route of transmission, measures for susceptibles, health promotion, indication for vaccination, side effect of vaccination. Thank you so much. I hope you all can understand this session. If you feel any kind of query with this session, please mention it in comment box. I will try to resolve it soon. Thank you so much. कितनी देर का होता है पता ही नहीं
कितने बजे शुरू होती है एक तुम मोबाइल तो लिया उससे बात कर लो एक बार पेशेंट बजरंगी जी है रिपीट करनी है कि रिपीट करनी है क्या मेडिसिन
देखो ना कितनी देर का
रिकॉर्ड हो रहा है